Hello and welcome back to the Learn Psychology series. Today, we are going to discuss an important therapeutic approach, behavior therapy. This is a widely used therapy for treating psychological problems, and it focuses on how behaviors and cognitions are learned and how they can be changed. Let's dive into it. Faulty learning. According to behavior therapy, psychological problems arise due to faulty learning of behaviors and cognitions. This means that when people learn things in the wrong way, it can lead to negative behaviors or distress. Faulty conditioning, faulty thinking, and faulty beliefs are all factors that contribute to maladaptive behaviors, which in turn cause psychological problems. Identifying and then challenging. Behavior therapy first identifies these faulty conditioning patterns and then challenges them. The goal is to set up alternative behavioral contingencies that improve the client's behavior. Cognitive methods also challenge faulty thinking patterns, helping the person to overcome their psychological distress. Finding the right behavior and the right solution. In behavior therapy, it is assumed that the therapist can discern the faulty behaviors and thought patterns of the client. The therapist's job is to find the correct, adaptive behaviors and thought patterns that would be more beneficial for the client. It's also assumed that the therapist is capable of arriving at solutions to the client's problems. From faulty to adaptive. The core benefit of behavior therapy is changing faulty behaviors and thought patterns into adaptive ones. This ensures a reduction in distress and the removal of symptoms. The client learns new, healthy ways of thinking and behaving. Treatment duration. Compared to some other therapies, behavior therapy and cognitive behavior therapy are shorter. These therapies are typically completed within a few months, making them a relatively quick way to address certain psychological issues. The past is relevant, but solutions are in the present. While the past may be explored to understand the origins of the faulty behavior, it's not the focus. Behavior therapy does not relive the past, but instead corrects faulty patterns in the present, helping the client to live happily in the here and now. Behavior therapy is not a unified theory. It's important to note that behavior therapy is not a unified theory. Instead, it consists of many specific techniques and interventions that are based on learning theory principles. The symptoms and diagnosis of the client are what guide the selection of techniques. Different disorders are treated differently. Each disorder requires a different set of techniques. For example, the treatment for phobias or excessive fears will differ from the treatment for anger issues or depression. Behavior therapy focuses on identifying dysfunctional or faulty behaviors and understanding the factors that reinforce and maintain them. Method of treatment. In behavior therapy, a client with psychological distress or even physical symptoms that are not linked to a physical disease is interviewed to analyze their behavior patterns. A behavioral analysis is conducted to find the malfunctioning behaviors, the antecedent factors that cause the faulty learning, and the factors that continue to maintain the faulty behavior. 3 key factors. 1. Malfunctioning behaviors are the ones that cause distress to the client. 2. Antecedent factors are the causes that predispose the client to indulge in that behavior. 3. Maintaining factors are those that lead to the persistence of the faulty behavior. Example of smoking behavior. Let's take the example of a client who started smoking during his exam preparation because it reduced his anxiety. The anxiety-provoking situation is the antecedent factor, and the relief from anxiety is the maintaining factor. The goal of treatment is to extinguish this faulty behavior and replace it with healthier ones. Antecedent operations and consequent operations. Therapists establish antecedent and consequent operations to change behavior. Antecedent operations involve changing something before the behavior occurs to influence it, while consequent operations involve reinforcing or discouraging the behavior afterward. Example of eating behavior. For example, if a child has trouble eating dinner, an antecedent operation could be reducing the amount of food at tea time to increase the child's hunger at dinner. Praising the child when they eat properly would be the consequent operation, reinforcing the desired behavior. We will discuss more on behavior therapy in the next video. I hope you now have a clearer understanding of how behavior therapy works. See you in the next one.